Hi, everybody. Welcome to your recorded resource on a reminder and a review on pharmacology A and P. So I guess it's more of a review of the A and P as it relates to pharmacology. So the nervous system, obviously the brain controls like everything. So understanding the basic concepts of the nervous system is so important. So this is going to kind of just go through some of those important features and parts. And actually, per our syllabus objectives, there are quite a few things about the autonomic nervous system that is very important. But I mean, the main thing is that understanding this nervous system processes is going to help you in class, understanding what's happening when we're giving these drugs or administering these medications in order to make our patient feel better. So, like I said, today's objectives are, besides our syllabus objectives that we're covering with this one as well, to review the anatomy of the nervous system, those important parts and pieces, and then really understand and learn that difference between the sympathetic and the parasympathetic nervous system, which are the two branches of that autonomic nervous system. And neurotransmitters, that's kind of how the brain talks to everything. And so we need to understand what those are and what they can do to the body. Now, central nervous system. The central nervous system is the brain and the spinal cord. That's it. Okay, so the brain and spinal cord is the central. So brain, spinal cord, straight down the back. It's the control center for the nervous system, and all of those other nerves are going to connect to it so things can be relayed to the brain and then messages sent back out from the brain. They say that the central nervous system tissue, that brain and spinal cord tissue, is very fragile, and it actually is the longest healing times of all tissues. That's why head injuries are so serious, spinal injuries are so serious, because even more than other tissue groups, it's not gonna, it might not come back from that, so it's very serious stuff. Now, the other side, so if it's not the brain and the spinal cord, but it's a nerve, it's part of the peripheral nervous system, which is PNS. Peripheral means kind of towards the outside. So the biggest kind of really important peripheral nerves are the cranial nerves and the spinal nerves. So there are 12 pairs of big fat cranial nerves that come off the underside of the brain, and they conduct impulses between different structures in the head, neck, thorax. If you remember those from A and P, you know that some are for facial expression, some are for moving the tongue, that kind of thing, the eyeballs, all of that stuff. We have to be able to control that. If you look at that little picture on the bottom, you can see the brain up top of that horse, and then all those cranial nerves. But guess what? It's not the brain and it's not the spinal cord, so it is not the central nervous system. The spinal nerves, I actually think there's 32 pairs of them, if I remember correctly. They connect the spinal cord to peripheral structures. So they branch out to be teeny tiny all along that peripheral nervous system, all the way down to the skin, the nerves on the skin for feeling, for heat, for touch, for pressure, all of those things. And some of those spinal nerves, like a sciatic nerve that goes right down the back of your leg, the back of your butt cheek, which can get really sore and pinched, but the animal friends can have that happen to them too. So what is the central nervous system? Only the brain and the spinal cord. What is the peripheral nervous system? All the rest of the things. So cranial nerves, spinal nerves, and the remainder of those branching peripheral nerves. So central nervous system, we know what that is. We've defined it. We're going to move aside from that. So for the peripheral nervous system, well, really the whole nervous system, there are two branches. So the first one, the easy one, let's just get this out of the way, is the somatic nervous system. So the somatic nervous system is completely on voluntary control. So you make the decision. Like, look, thumbs up. I made that decision. Give you a thumbs up. Look. Peace sign, right? Look, punch. Look, the table moves. So any action that you choose to do for whatever reason, even if it's weird, that is done by the somatic nervous system. So you weirdos make the decision to have that voluntary control. So when your brain decides that, it sends that neurotransmission directly to that muscle or that muscle group for action. And then it stimulates those muscle fibers themselves through motor neurons. Motor kind of means action. It takes them there to make something move. Okay, somatic, we got that? Do a somatic motion. Now, the other branch of the peripheral nervous system is called the autonomic. So it's kind of like an automatic nervous system. So it's all the tons and tons and tons of things that luckily we don't have to think about every second, or I would be like really distracted. Right? Anyway, the involuntary functions of the body considered automatic is that autonomic nervous system, or the ANS. It really works well with the cardiac system, the cardiac muscle, smooth muscle, and also even those glands. A lot of the glands that produce, bile and, bicarbonate and things, the muscles or the glands themselves have to be controlled by nervous system control, basically. Now, taking that autonomic nervous system, or the ANS, to a whole new level, we're going to split that down into two important groups. This is just kind of a good picture here. So autonomic overall, I just like that the somatic is over there on the side and it just no ganglia, just goes all the way down. Acetylcholine works on making that muscle contract, and you just did a kung fu karate chop. Now automatic, you've got your sympathetic and parasympathetic. Those go down, and there's a whole different process that goes along with that. And then it lands on the effector organs that can make an additional process happen as well. So ANS, autonomic nervous system, autonomic, yep, I can talk, is unconscious body activities. So automatically done by your body. Those two divisions are parasympathetic, which is also known as cholinergic, and sympathetic, which is known as adrenergic. And trust me, it's going to get even more confusing. So I suggest we write that down, because there's a lot of different terms just to describe one or the other of these two systems or subdivisions. So sympathetic is your adrenergic. So think of adrenaline. It is the fight or flight. It's what happens when a scary clown is chasing you through a parking lot. Your body kicks into action to either run away, get out of that situation, or turn around and fight it. I'm probably more of a flight kind of girl, but you know what? There's a lot of fighters out there too. So in that moment, your body is doing these very basic natural things in order to prepare yourselves for that fight or flight response. So the heart rate and blood pressure will go up. It's wanting to pump that blood. That way you can get more use of the blood to those skeletal muscles. Airway diameter opens, so you can get air as you're running across that parking lot and don't choke. Increases the blood flow to skeletal muscle itself, right? That's important. If you're going to run or fight, you need to be able to have blood pumping through those muscles. And it decreases the blood flow to the GI tract. So at that moment when that scary clown is chasing you, the body doesn't really need to digest food at the time. It doesn't really need to make urine. Okay, so it really doesn't need to match all the things that it does at other times. So it actually kind of shunts the blood flow from those areas so it can get to the blood areas that it finds to be important, like the heart and the lungs. So the sympathetic nervous system can be stimulated, or those side effects can be brought up and brought more active by drugs that are called adrenergic drugs. So sympathetic system is the adrenergic nervous system, and it's affected by adrenergic adrenaline drugs. So fight or flight, it'll boost that sympathetic nervous system. Adrenergic drugs can also be called anticholinergic. Hold that thought. The parasympathetic nervous system is often called rest and repose, R&R, but I like to call it rest and digest. It helps me remember that digestion and all of those GI processes, urinary processes, and things like that for nutrition are directly affected by that parasympathetic nervous system. So it is also called cholinergic. So that's why, just to make things more confusing, those anticholinergic drugs would be anti-parasympathetic, therefore sympathetic. Now, let me kind of take a second to explain that this autonomic nervous system it is a 100% scale, okay? You can't have both going on at the same time. So if you have 75% on of fight or flight, you're only going to have 25% on of parasympathetic. But then you know what? If it's Thanksgiving dinner and you eat all that turkey and you eat all that food and you eat way too much and you get so tired, that parasympathetic system is coming up, well, I would say 99%. 99% parasympathetic, rest and digest, and only 1%. That's why you feel like, oh, I just can't get up. I ate too much. Oh my goodness. Yeah. So your body actually does want you to lay down and take a nap and not move and let it do its thing. Okay. So that thing is that it actually can lower your heart rate. It'll actually send more blood flow through organs that need that, like the kidneys, the liver, and the GI tract. It'll increase GI and glandular activity. So remember, it wants you to rest. It wants you to digest. So it wants to make urine. You know, that's the time that your bladder can get full and all of those things. These are increased, parasympathetic is increased by cholinergic drugs because it's the cholinergic system. Makes sense. Cholinergic drugs are the anti-adrenergic because remember, it fights that battle of that scale that has to equal 100%. Does that make sense? So adrenergic system is sympathetic, fight or flight, works with adrenergic drugs, and they are anticholinergic. So they kind of stop the processes of parasympathetic. Parasympathetic is the cholinergic nervous system, and it is affected by cholinergic drugs and therefore anti-adrenergic. So that sympathetic nervous system will go down. Oh. So how does that even happen? So the neuron is a nerve cell. The neuron is the functional unit of the nervous system, and you're made of like bazillions of them. Don't quote me on that number because I just made that up. But those messages are communicated between these neurons, which are the nerve cells, which build up these nerve fibers that communicate from top to bottom, literally. So just a quick reminder on neuron anatomy. So there's a picture of a neuron there, and that center dark maroon dot is the nucleus. And then the body, which is essentially the cytoplasm of the cell, is called the soma. Now, all those finger-like projections outside of the body or the soma are called dendrites. And there's so many of them because it's so many entrances to that nucleus. So it can be taking in information from all of these different nerves and impulses that it's receiving at the same time. So remember, when there's lots of different finger-like things in the body, usually that's for surface area. Now, the dendrites receive the information through those fingers and it sends the message. It sends it afferently to the nucleus. Nucleus is kind of the brain of that cell, and then it sends the message down that long axon. That tail piece is called the axon. That axon breaks off into axon terminals, and those axon terminals are going to approach the next neuron. So this neuron in this situation would be called the presynaptic neuron, and then there would be a synapse, or like a little river that's very small in between the axon terminal or the telodendron and the next neuron. While I'm on this picture, I want to point out that this nerve is myelinated, which means it has myelin, which is a special part of the tissue of brain tissue or nervous system tissue, and it can send messages faster. So myelinated nerves move faster than non-myelinated nerves. So there is where that telodendron is at the end of that axon. You can see that. So branched end of the axon is called the telodendron, and it can also be many different branches as well. On the telodendrons, there's these little sacs that's where the neurotransmitters live. They're in the little sacs waiting for that neuron to be stimulated to let them go into the river so they can start that process in the synaptic cleft. So those little pieces, those chemical messengers, they're called neurotransmitters. And the neurotransmitters are what are going to stimulate different reactions, and they can cause different things to happen when they reach a certain receptor. Okay, So that river that I was talking about, that river that's between the telodendron and the next neuron, okay? That river right in between is called the synapse, okay? Because these neurons are functionally connected, but they are not physically connected. Does that make sense? So by functional connection, that river is kind of what moves things back and forth, that synapse or that synaptic junction. Now, that is, okay, let me get to this right here in blue so you can kind of see what I'm talking about. It's a good image of that. So this is showing two neurons. They have the dendrites in the front, the soma, which is the body, the nucleus in the center, and then they both have an axon, and they both have the telodendron or the axon terminal. Now, there's the synapse, which is the little river. So you can see how, or you can picture, I guess, not see how, that the telodendron, if that line, that shore on the river was full of little sacs with different neurotransmitters, and they would dump into that space and diffuse or kind of float over to touch the dendrites of the next neuron. So there's an arrow up top. That arrow is showing the direction that the nerve impulse is going. So it is going from, remember, dendrites, body, axon, spread. Dendrites, body, make a song out of that. So the impulse direction is one way, and that synapse is a really important spot. So since we know those directions, there are two really important terms about nerve impulses and what direction that they're going. So let me start with the bottom one, actually, afferent. Afferent, I kind of think in my head that we're adding, okay? ADD, hey, I know it all about that. AFF, okay? So afferent means going towards the cell body. So like I said, from the dendrites, it's moving afferently, so with towards. And then also incoming messages that your body needs to send to the brain, those are moving afferently because all the information needs to go up to the brain. So it goes afferently towards the brain or towards the cell because that neuron nucleus is kind of like the brain of that cell. So afferently is like adding, you're going towards, going towards, going towards. Now, efferent, EFF, is going away from either the neuron's nucleus or from the brain. So dendrites afferently send the message to the nucleus. Once the nucleus sends it towards the axon. Now it's going away from the brain, so it becomes an efferent message. Same thing, that if you stub your toe, it's going to that ow response is going to go up the leg, up the spinal cord to the brain to tell the brain that you got hurt. And then the brain is going to tell you, well, hop on one foot. That's going to make it feel better. Ow, 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 right? So the message to move is efferent. It's going away from the brain and it's going to tell you to move or to do some type of action. You can kind of remember that, like efferent, like F off means go away. Afferent, adding it in, F off, go away. I just thought this picture was kind of cool, a little bit almost more realistic looking. The neuron on the left is called the presynaptic neuron because it is before the synapse that we're talking about. That makes sense? Then that message gets picked up by those dendrites on the front. It gets sent afferently towards the nucleus. Nucleus processes the message and sends it efferently down the axon to that telodendron. But you can see how it almost looks like spider webbing because there's actually so many little pieces. Remember, they are not connected physically, they are connected functionally. So now we're at that synaptic cleft. Those neurotransmitters, they are up and they are ready for action. So those neurotransmitters are those chemical messengers that are needed. It's how they communicate. They speak through neurotransmitters and enzymes breaking things down. That's what's happening in there. So when that neuron is stimulated a certain effect, it's released into the synaptic space, which is very narrow, and it diffuses across the synaptic space, and it's going to kind of flow across and just touch that postsynaptic neuron, which has receptors on it. So it has to be the correct, go forward really, hold on. Don't mind my forehead. Okay, perfect. It has to be the right shape to be able to fit into its receptors. So like epinephrine has epinephrine receptors or whatever. So that's kind of important. It's also important to understand that if it was just continually releasing and continually stimulating that postsynaptic nerve, your body would go crazy. So these enzymes, I like to call them the enzyme alligators, they like live in the synaptic space. And as things are flowing across, they are inactivating them. Okay, so they inactivate the neurotransmitter molecules. The example on here is acetylcholine. If you guys took A&P, you know that acetylcholine is a really, really important neurotransmitter that's important for muscle contraction, so an actual movement. Now, in that synaptic cleft lives the enzyme acetylcholinesterase. See that esterase on the end? That means enzyme usually. So that enzyme is breaking down acetylcholine as it goes through. So that will stop and the muscle will be at rest. Otherwise, you'll be kind of like stuck where you are if there was nothing to break it down. Cool thing about that is those alligator enzymes, they break down that acetylcholine, but they don't just like eat it, destroy it, make it go away. They actually bring it back to the telodendron of the presynaptic neuron and repackage it nicely. Reduce, reuse, recycle. So how we are putting this, or how and why, let me think, why it is important to understand this is because how we do pharmacology, the therapeutics of it, we are going to essentially mimic something that's happening with the neurotransmitter. So do that action synthetically, extend, make what's naturally happening in the body stay longer, enhance, make more of it, or even block with appropriate drugs. So if you have one reaction from a neurotransmitter, if it's blocked, then that reaction will reduce. So you can think of all these different drugs and different reasons that an animal needs medication. So that's why it's important to understand how that concept even works. So those neurotransmitters, the ones that are directly linked to the sympathetic nervous system, fight or flight, are those adrenergic neurotransmitters. So the primary one is epinephrine, which is your adrenaline, norepinephrine, and dopamine. The parasympathetic has its own, they're called cholinergic, and it helps you remember because colon, like not that kind of colon, but like acetylcholine. So they match there. So acetylcholine, the same neurotransmitter that helps muscle contraction, is also the primary neurotransmitter of the parasympathetic nervous system. Now, those were the neurotransmitters, but there has to be specific receptors that they're able to stimulate on the other side. So the receptors of the parasympathetic cholinergic nervous system, there are two. One is called nicotinic, like nicotine, stimulated by low doses of nicotine. Muscarinic, stimulated by muscarine and parasympathomimetic drugs. See, there's another word, parasympathomimetic. So that means mimicking parasympathetic, okay? So you can kind of add that to your list. So some of those stimulating that receptor is going to have to do with salivation, lacrimation, urination, defecation, dyspnea, and even emesis. The sympathetic or fight or flight receptors, so the adrenergic nervous system, is alpha 1, alpha 2, beta 1, beta 2, and dopaminergic, so related to pertaining to dopamine. Yeah, I bet it does sound Greek to you. It can be a lot. Just make sure you're referring and practicing and studying that handout that I gave you. So, like I kind of started to explain, why it's important for pharmacology to understand this is because when we're using these drugs that affect the nervous system, they can either mimic neurotransmitters specifically, interfere with the release of neurotransmitters, block the receptor pathway, or even interfere with the breakdown or reuptake of the neurotransmitter by those enzymes, remember alligator enzymes, in that synaptic space or synaptic cleft. So, classes of autonomic nervous system agents or drugs. So a cholinergic agent is going to be plus parasympathetic. Cholinergic blocking agents is going to be anticholinergic, but then that also means it's adrenergic, sympathetic. So remember, it's really important to understand that concept that it is moving all the time. of who's in control, sympathetic, parasympathetic. So adrenergic agents, sympathetic, adrenaline, they can also be called sympathomimetic, so mimicking sympathetic nervous system. And then adrenergic blocking agents, so they're going to be obviously pro-parasympathetic, so cholinergic, can also be called sympatholytic, like lysing or breaking up. They're breaking up with the sympathetic nervous system. So cholinergic agents, so we're plus parasympathetic cholinergic system, stimulate receptor sites mediated by acetylcholine. Remember, that was that primary neurotransmitter of parasympathetic. It can mimic or inhibit breakdown of the acetylcholine, so they're also called parasympathomimetics, mimicking parasympathetic nervous system. Just some examples, we'll talk more individually, but so you can kind of get the concept of what I'm trying to teach you here, is that cholinergic agents are great for treating or decreasing ocular pressure. Because remember, when you're stimulating parasympathetic, you're reducing blood pressure and heart rate. So pressure of the eye. So there's eye drops that are cholinergic agents that can actually reduce the pressure from glaucoma. Controlling vomiting, treating urinary retention, or even stimulating GI motility. So giving something that increases parasympathetic, aka a cholinergic agent, is going to make that focus about rest and digest. Here's a couple examples. So metoclopramide is trade name Reglan, and it's used to control vomiting, usually vomiting from just like a sick stomach. What do you call that? Like a sour stomach. And it promotes gastric emptying. So some people and animals have an issue where the stomach isn't mixing in as much as it needs to, and it's kind of sitting in there and fermenting and getting a lot of sicknesses from that. So this is going to promote gastric emptying to keep things moving right along. And then this bethanechol, urocholine, treats urinary retention. So there is some type of disease processes that makes the bladder, the urinary bladder, hold onto urine longer than it should. So it's holding in urine and not letting everything out. So this would be a drug, because remember, with your parasympathetic plus, that's when you make the peeps. Cholinergic blocking agent. So now we're going to block acetylcholine from combining to the receptors. So it can be used to decrease GI activity, so maybe slow down some vomiting and diarrhea. Used pre-anesthetically to prevent bradycardia, because remember, that is going to, sympathetic is going to boost that heart rate, and parasympathetic is going to drop the heart rate. So if we want to prevent bradycardia, especially if we're giving other drugs that causes low heart rate, an anticholinergic is going to do the trick. If a doctor needs to look in the eyes, we're going to dilate the pupils by using an anticholinergic agent. And treating sinus bradycardia in large and athletic dogs. They just have these large, slow heart rates, and sometimes that can cause kind of a low blood pressure, and it can cause some of its own issues. Most commonly used drugs, I put atropine on here as an example. That's a very common pre-anesthetic drug that we use for preventing bradycardia. We also use it to dilate pupils, and we also use it to dry up secretions like saliva, especially pre-anesthetically. Right? So the phlegmy type dogs, kind of the push faces, the brachycephalic dogs, they often can get clogs in their trach tubes during surgery, and they're all just super slimy. Or even when they are waking up and they're nauseous from the drugs maybe that they were given, and they start to hypersalivate. So giving a pre-anesthetic drug like atropine can actually help prevent that or stop that. This next one down here is propanthyline bromide, and it slows GI movement. So it's blocking parasympathetic. So it's not letting the parasympathetic do its job for digest. Decreases stomach acid production. So it's commonly used to treat gastric ulcers. So adrenergic agents, sympathomimetic, so mimicking sympathetic, is going to be used to prolong effects of local anesthetics, because definitely vasoconstriction, so not allowing blood flow. So if you use a local anesthetic, like maybe on a laceration repair, it's going to have less bleeding if you put something in that area, so that way the blood is constricted. It also delays the uptake of local anesthesia. Treating glaucoma, It actually reduces the amount of aqueous humor itself, so that watery fluid that's in the eye. It's used to stimulate the heart during cardiac arrest. So we use that a lot in emergency situations. Reverse bronchoconstriction, when somebody or an animal is having an asthma attack or an anaphylactic reaction and they're having a hard time breathing, giving a sympathomimetic drug opens that airway. Remember, fight or flight, bring all that air, send blood to the muscles, heart and lungs. So all those effects could be useful as a side effect that we're using as a therapeutic drug. Now, strengthen the heart. So in patients that have congestive heart failure that the heart needs to beat harder, stronger, maybe even a little faster. Correcting hypotension, so correcting low blood pressure. So it can increase the rate and the amount of contraction of the heart, and also cause peripheral vasoconstriction. So it kind of circulates that blood to all the major organs. Reducing capillary bleeding, we'll talk more about that, but it's pulling the blood away from the skin. Remember that at the time, because it's not important to be there. So it can help with bleeding. And also treating urinary incontinence when that urinary bladder sphincter just doesn't have the strength that it used to. So the body isn't working on parasympathetic. So if we are shunting blood away from that area, it's going to actually help with urine leakage. Now, the adrenergic agents, because remember, there were all those different receptors. So each receptor does its own thing, and that's important to understand, because the drugs we use are going to then be classified by the receptor that they either stimulate or block or mimic or whatever. So alpha-1 causes vasoconstriction of blood vessels, smooth muscle contraction. So it reduces blood flow to the PNS target areas. So it's going to actually decrease congested mucous membranes of nasal passages. So it's going to cause easier breathing. Don't use this as much in animals, but it needed a good example. So pseudoephedrine or Sudafed PE. So that's a nasal decongestion. Sometimes when you have a really bad cold, you feel like you have to blow your nose all the time, but nothing's coming out because you're just congested. Everything is full of fluid. It's like edema, blood, all of that stuff. And so a decongestion is going to pull all that fluid and that blood out of those capillary areas and make you breathe more clearly. Alpha-2 inhibits the release of norepinephrine. That one's going to be confusing, and we're going to talk more about that next week. But basically, when the body is in any type of stress, it releases, or fear, releases norepinephrine. Alpha-2 kind of keeps that in check and stops the release of norepinephrine. So actually, as weird as it sounds, it actually will cause sedation. So xylazine, that I used in my example when I was talking about Dana the Great Dane, is a sedative, as well as dexmedetomidine, which is dexdomitor. So those are the two drugs that I was actually talking about when I told the story of Dana and getting both of those drugs in the same day. Adrenergic agents that have to do with beta-1, just remember, your heartbeat is number one. You're number one to me. Your heartbeat is number one. So beta-1 receptors are on the heart. To agonize, which we'll talk about agonistic drugs later on. So stimulation is what that means. When a drug is stimulating beta-1 receptors on the heart, it is going to increase that heart rate, resulting in a tachycardia. It is going to strengthen the contractions by the cardiac muscle itself and rate of depolarization wave through the heart's conduction system. So it works directly on the heart itself. The beta-1 receptor on the heart is responsible for that racing heart from fear, or when you get super excited, or, exercise, I guess, fine. But I don't get excited when I'm exercising. But that same thing is when your heart's pounding and it feels like it's in your throat. Beta-1, your heartbeat is number one, is responsible for that. Beta-2 receptors are located on smooth muscle and skeletal muscle specifically. The smooth muscle that it handles, or that it's in contact with most, are the smooth muscles that are around blood vessels in the heart. Remember, vessels are muscles. That's why they can vasodilate and vasoconstrict. So the smooth muscle, beta-2 receptors on the blood vessels in the heart, the arterioles, and the bronchioles in the lungs. So heart and lungs for those as well. So it's going to open things up and help things breathe. Yeah, so Ventolin, or this albuterol inhaler I have pictured over here, that's for asthma. Things are wheezing, having a hard time breathing, that inhaler is going to go in and it's actually going to release and open up the bronchodilation in the lungs so that more air could actually get in there. It so causes that relaxation of the muscles. We just talked about that, skeletal muscles and heart bronchodilation, and therefore more oxygen. That is a kitty cat using an albuterol inhaler through a little contraption that's called the Arrow Cat. We'll talk about that with respiratory drugs. So the granddaddy of the sympathomimetic agents is the alpha and beta agonist. So A1, A2, B1, B2, epinephrine. Okay. It is synthetic epinephrine, that neurotransmitter of the sympathetic nervous system, on its own. So increasing heart rate, increasing cardiac output, constricting blood vessels in the skin and shunting that to the major organs in the body, dilating blood vessels in the muscles themselves, the bronchioles for more oxygen intake, and increased metabolic rate. So the primary use of this drug is anaphylaxis and cardiac resuscitation. Anaphylaxis, extreme allergic reaction. That's what I'm talking about. And then the minor thing that we use it for is sometimes we'll drip it in the nose when an animal has epistaxis or a chronic nosebleed, because it shrivels up those blood vessels in the skin and stops bleeding. So that's pretty interesting. There's your fun fact for the day. Alpha-1 antagonists. So we're going to get more into agonists and antagonists next week, but adrenergic blocking agents. So an antagonist is a blocker drug. So antecedent is the reversal for those alpha-2 agonists. So the alpha-2 agonists stimulate, alpha agonist stops. Okay, so that's why we're able to have a reversal for drugs like dextrometor, but we'll go over that during sedation a lot more. Beta blocker, you might know somebody who's on beta blockers for their heart or their blood pressure. Remember, the betas are on the heart. So if they are beta 1, your heartbeat is number 1. If they are beta 2, that's going to have to do with the rest of that. And propranolol is the most common beta blocker. So helps treat arrhythmias, it lowers heart rate, and then it has an effect on blood pressure as well. So summary for this is to remind you that the central nervous system is only the brain and spinal cord. The peripheral nervous system are the cranial and spinal nerves, and then all the rest of those little parts and pieces of nerves throughout the body that's not the brain and spinal cord. Somatic branch, doing your own motions. Autonomic is automatic. Sympathetic is adrenergic. Parasympathetic is cholinergic. And the receptors with their primary uses are listed there. So that will help you understand exactly what we're talking about as we're going to talk about these drugs that are stimulating, blocking, mimicking, and increasing these neurotransmitters.